Hi guys, and welcome back to my channel. My name is Hannah and I am a sexual health nurse. So 5 reasons why you should not be becoming a sexual health nurse. Public apology to my managers and everybody I work with, because this is probably not a video that they're expecting me to do, but I think it's really important things to consider before you apply for sexual health nursing. Number 1, if you are somebody that likes to do those 12.5-hour shifts, sexual health nursing is probably not the one for you. Now, the sexual health clinic that I work in, we do 8-hour shifts. We used to do 12-hour shifts, but they realised that a lot of the staff were getting burnt out in the 12-hour shifts, and also that it's a lot harder to cover a shift for 12 hours if somebody is off sick than to cover an 8-hour shift. So we now do 8-hour shifts. This is not the same for every sexual health clinic, but you're probably going to be doing slightly shorter days and slightly more days per week. So if you're somebody that only wants to be doing 3 shifts a week but still working full-time, sexual health nursing may not be the best for you. Leading into that, you don't have as much opportunity to do unsociable hours or bank. So if you're working full-time, there's going to be limited time that you can do bank shifts. And we don't work nights as sexual health nurses, and we don't tend to work too many weekends, or not at my clinic anyway. So every 6 or 8 weeks, I will work a Saturday, and that's all the weekends I have to work unless I choose to do extra shifts. Obviously, we don't do any night shifts. So again, you get a lot of bonuses doing weekends, nights, and bank holidays. One bonus of working in sexual health nursing is that we're never going to be working a bank holiday. We always get Christmas Day off, but we then don't get the enhanced pay that the bank holidays, the Christmas Day, nights pay. So if you're somebody that wants to be working a few extra shifts a month to get a lot more income, sexual health nursing, again, is probably not the best avenue to go down. Number 3, if you're somebody that loves patient continuity, sexual health, again, is probably not the best place to work. In HIV, you do get more patient continuity because you get the regular patients coming back to check their bloods, do sexual health screens, etc., etc. I'm not a HIV nurse, so I'm not the best person to ask about that. But with sexual health, you might see the odd patient again, but it's not going to be a regular occurrence. In the wards, obviously, you build a really good relationship with your patients because they might be there for days, weeks, even months sometimes. So you can really get to know the patient on a more personal level. In the GP, you also get that because you might have a patient coming in for repeat diabetes checks, repeat warfarin checks, also repeat wound care, which is a weekly thing. So you do get more patient continuity. In sexual health, you don't tend to get that. Your patients might come in more frequently, but you might not be the nurse that's seeing them. So you might only see one patient once. And that's, for some people, is absolutely fine. For other people, they prefer the continuity. The next thing is, if you're somebody that struggles to adapt to certain situations, then you're probably not the best person to be going into sexual health nursing. The reason being is that you need to be really flexible. Your patient might come in saying at reception that they only need an asymptomatic screen, when in reality they might have a sexual health need that needs to be dealt with. They might have been sexually assaulted. They might need PEP. There might be a whole range of things, and you need to adapt to the situation. Also, sometimes I've had it where I've finished a consultation with a patient, and just before they've gone to leave the door, I've said, is there anything else that I can help you with, that you're concerned about, that I might be able to support you with? And they've actually said, yes, I really need help with this. And then that continues your consultation for quite a lot longer than you expect. But that's what that patient needs. So you need to be able to adapt. Another thing is that you might go from seeing somebody that's been really violently sexually assaulted, and you've been supporting them through that, through either a past sexual assault or quite a recent sexual assault. And then you've got to go from that's quite emotional and difficult, to a patient that might be coming in and just needing a screen and they don't have any symptoms. And you've got to completely change and switch those emotions off, and then go into this consultation pretending that you haven't just heard something that's actually been really difficult to hear, or that it's been a really difficult consultation. So if you're somebody that's not very adaptable and that can't kind of put a poker face on in stressful and hard situations, sexual health nursing might not be the best option for you. Final point, if you are not open-minded, you are not accepting of other people and other people's viewpoints, we don't want you. Please don't come and work with us. I don't want people who work with me, and our patients don't want nurses that are homophobic, transphobic, that are judgmental of certain religions, cultures. We just don't want it. We as nurses and health professionals are meant to be open-minded, accepting and non-judgmental towards our patients, but also giving them evidence-based practice. So obviously giving them the facts and the evidence of this is how you might get gonorrhea, this is how to reduce your chances of a sexually transmitted infection in pregnancy, and giving them the evidence but not putting in any of our own personal opinions and feelings. If you're somebody that feels that they can't do that, then sexual health is definitely not the right job for you. Okay, I hope that's been really helpful. 5 reasons not to become a sexual health nurse. If you feel that those 5 things don't apply to you and that actually they kind of sound quite appealing, to have quite set hours, to be more adaptable and flexible, then please apply and come and join us. I absolutely love working as a sexual health nurse and I love the job. Thanks guys, thanks for watching. Please don't forget to like and subscribe to my channel for more sexual health, contraception and relationship advice. And if you want to know 5 reasons why I think you should become a sexual health nurse and why I love sexual health nursing, stay tuned. Another video is out or potentially coming out, depending what order I put these videos out for you guys. Take care, bye-bye.